If I could, I'd like to get the first slide at this point. If you will, take a look at this slide. This is drawn from the DSM-4, which is the Diagnostic and Statistic Manual of the American Psychiatric Association. These are the criteria that we use to diagnose ADHD. I'm going to read them real quickly for you. Under hyperactivity 1 through 6, often fidgets with hands, feet, or squirms in the seat. 2, often leaves seat in the classroom or other situations in which remaining seated is expected. 3, often runs about or climbs when not appropriate. Adolescents or adults may be limited to subjective feelings of restlessness. Often has difficulty playing or engaging in leisure activity quietly. Often on the go or acts as if driven by a motor. Often talks excessively. Now, what we see in this group of symptoms in 1 through 6 is a poorly regulated demand in a situation, and that's where you have excessive fidgeting, restlessness. Child looks like they're on the go. They exhibit an excessive amount of movement not required to complete the task. They're moving their hands, they're moving their feet, they're tapping, they're rocking. They will rock their arms, legs, shift in their chair, squirm in their chair. They'll do a lot of things, but this activity is task-irrelevant activity. They can't control it. They try to, but they cannot control it. They'll have problems with this impulse control and inability to moderate their responses. So what we're looking at is an inhibition in their reactions. And you might think of this as an inability to delay gratification. We see this in the inability of a child to stop and think before acting and reacting. For example, on the playground, you can't wait their turn. They have trouble waiting in line. They interrupt conversations. They butt into what other people are saying and doing. They blurt out the answers when the teacher is just getting ready to give a question. It may be the wrong answer, but they think they got the right answer in the way they go. They have trouble and difficulty stopping their behavior when it becomes clear that their actions are no longer effective. In other words, they have difficulty seeing that another response would be effective. They have problems resisting distractions while concentrating on work. They have problems being able or willing to work for larger or longer rewards. In other words, smaller rewards sometimes are better because they basically want or need gratification at a shorter interval. So they have quick rewards, will typically get a better response with an ADHD child. They have problems stopping their first reaction to an event without evaluating more effective responses to the situation. So if they meet 6 or more of the criteria in 1 through 9, they're going to obtain an ADHD diagnosis predominantly hyperactive or impulsive type. Go to the second category. I guess we'll read impulsivity. Often blurts out answers before a question has been completed, has difficulty awaiting his turn, often interrupts or intrudes on others, that is, butts into the conversations or games. So what we have then is impulsivity, again, is the inability to control what's going on. These children are good kids. Parents know they're good kids. I know they're good kids when I work with them, but I also know that they have great difficulty in controlling their behavior. Let's look at inattention, the third category, number 10 through 18. Child often fails to give close attention to details or makes careless mistakes in schoolwork or other activities. Often has trouble sustaining attention in tasks or play. Often does not listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. Often has difficulty organizing tasks and activities. Often avoids, dislikes, or is reluctant to engage in tasks requiring sustained mental effort. And you can read homework and schoolwork for kids here. often loses things necessary for task or activity. That is toys, school assignments, pencils, books, tools, you name it. If it's necessary, they can lose it. They don't mean to. It's just a habit of distractibility. Number 17, often easily distracted by extraneous stimuli. That means outside of themselves, things that are occurring outside of themselves. Number 18, often forgetful in daily activities. So this category presents problems in the area of attention. This substantively is different from the hyperactive impulsive behaviors that we were listing earlier. And there you saw impulse control and excessive activity. Here we see a problem in sustaining attention or maintaining persistence towards the completion of a task. This is often seen in children assigned or involved in something that's boring, tedious, lengthy, or simply a repetitive task which lacks reinforcing value for them. So they don't see it as being very entertaining. They often fail to demonstrate the same level of motivation or stick-to-itness or persistence as seen in peers of the same age. Now this occurs when it's an uninteresting but important assignment that must be completed. So it may be tedious, but it has to be completed. That's an important point. They often report being easily bored with assignments and they stop, changing their focus to something else and without completing the task or the assignment. So they seem to go from one uncompleted activity to another. And this loss of concentration and focus with long or tedious tasks is commonplace. They also show an inability to return to their work if interrupted. So they're easily distracted at times when concentration is required. They often have difficulty completing routine assignments or independent work without direct supervision. Frequently somebody has to help them. In most cases you're going to find mom is there trying to work with homework, but it also is a stress on mom and on the child. Frequently the following words or phrases are used to describe a child like this: daydreamer, passive, they seem mentally confused, exhibit slow or social quietness or apprehensiveness, they have a low activity level, something like a couch potato maybe, which is not a flattering term, but it may be accurate. If you've met or a child has met 6 of the criteria in 10 through 18, and they're going to be given the diagnosis of ADHD, predominantly inattentive type. If a child shows enough symptoms in the predominantly hyperactive and inattentive type and in the impulsive type, what happens is we will combine those two into another diagnosis, which is ADHD combined type. And this simply shows combined features of both criteria. And it has treatment implications that we probably don't need to talk about right now, but one of those is medication. It's important to know what type of ADHD you're dealing with. And so that kind of ends my slide. If you've stuck with me so far, and I know it's been a little tedious, if you have ADHD, it's probably a little problem, but I've got a lot of things to cover here. And if you're really sharp, you probably would have noticed that any child can show these types of behaviors, and any child could get diagnosed with ADHD. And you'd be correct, but there's some additional requirements that we look for. One of those is the frequency of the behaviors. How frequent and how often are we seeing this behavior? The chronicity of the behavior. In order for a child to be diagnosed with ADHD, they have to have shown these types of behavior for 6 months or longer. And this is typically going to be compared to the children of their age. We also look for disruptiveness and negative consequences of these behaviors in the child's life. Generally, it's noticeable when compared to peers of the same age. So we're going to be asking, what's the intensity of this behavior? Another thing that we look for is behavior across different life domains or settings. And that simply means that we're looking for behavior at home that's ADHD related. We're looking for the same type of behavior at school, and we're looking for the same type of behavior in play with their peers. And if you feel like that your